Healthcare organizations exist to see and care for patients, but how can they provide access to care when patients no-show or cancel their appointments last minute, causing disruptions in schedules and underutilization of provider and staff resources? Welcome to this edition of the eClinicalWorks podcast. I'm Adam Salati. healow has developed the no-show prediction module, an AI-powered tool that trains itself on your scheduling history to predict whether upcoming appointments will occur successfully before they even happen. healow displays this information as a probability for each visit that will or will not happen as planned so that your staff and your teams can take appropriate action, either helping those patients to come in or by strategically double booking appointments to ensure that time is utilized by another patient. Here to speak with us today about their experience with the no-show prediction AI is Stephanie Boik, Director of Quality and Risk Manager at Centerpoint Health. Stephanie, thank you so much for joining us today.
Thank you for having me.
Stephanie, tell us a little bit about Centerpoint before we begin.
So Centerpoint Health is a federally qualified healthcare center that we opened in 2014. We currently serve the southwestern Ohio area, so mainly Butler, Warren, Hamilton, and Montgomery counties. We are a family practice, so we also have pediatric services, we have dental services, integrated behavioral health. We also have OBGYN. School-based health center is what we have in Hamilton County. We also just recently opened our 340B pharmacy. We are a patient-centered medical home, and that's how we can offer all of these different services for our patients. And in 2023, we actually served 6,041 patients in that southwestern Ohio area.
Well, that is a lot of services, and you got a lot of moving parts there. So I'm sure it's especially important for Centerpoint to make sure that patients are able to come in so that it can actually utilize those services and get benefit out of those services. Tell me a little bit about why no-shows were a problem that you wanted to focus on and try to, what you thought you could do to address those things.
So for us, it was more about those missed opportunities. We were looking at patients that not only were no-showing, but also the amount of patients that were canceling, the amount of patients that were rescheduling, because we need to have access for our patients. And with those missed opportunities also comes decreased access.
So you guys started to use the no-show prediction AI, and you took a risk on that. Tell me about how that started. When you kicked off that project, how long ago was that, and where did you begin?
We started with the project in July of 2023. So when we initially went live, we were using the EBO report version. We were able to look at this report. We could see that percentage of how likely this person was not going to show up for their appointment or possibly cancel or reschedule, and then providing that information to outreach staff, to registration staff, and they would work this spreadsheet to call patients. Originally, we started out at 85% and above because we were a little timid at first, just not sure if this really was going to be effective because it was very new for us. We were given the opportunity to upgrade to V12 in October of 23 when we integrated no-show prediction assistant that was built into eClinicalWorks, streamlined this process and made it so much easier for the staff. This way, we just trained everyone on the no-show prediction assistant. And at any given time, if there was openings in the schedules, anything like that, whenever we as a staff had the opportunity, we would just guide them into this integrated assistant, and then they were able to call from there.
Stephanie, for the people who are watching who don't know as much about the module, when you say 85%, what you mean is that the prediction from the AI for the likelihood that that visit will not happen successfully is an 85% chance, giving you a high confidence that unless you do something about it, this visit is not going to happen successfully. So you targeted 85% and above to start, and you move that down as you get more confident and as you get more comfortable with it. What is your process? When you see the prediction, when you see the likelihood that this visit is not going to occur the way you think it is, what do you do with that? What do your staff do?
The first thing that we would do is we would call all of those patients 2 days before their appointments if they weren't already confirmed. We focused on dental being at 60% likelihood, and medical we moved down to 80%. So we would go ahead, reach out to the patients, try to confirm those appointments. The big thing was, even if we were able to get in touch with that patient, we still would not mark them confirmed. We would allow the reminder campaign that we have set up in eClinicalWorks to also go out to that patient to just give that extra layer of, yes, we've called you and we've reminded you, but now you're also going to get a reminder call, you're going to get a reminder text or a reminder email. And then if we weren't able to confirm, we weren't able to get a hold of them, our reminder campaign, they did not confirm that way, we created a visit status called canceled unconfirmed. So in the morning when front desk arrived, they're going to look, they're going to see those patients, and they're going to see that they're canceled unconfirmed. And once those patients were marked canceled unconfirmed, we had designated for dental, we would look at the wait list, we would use those appointments to fill those empty spots. And then for medical, we would leave those slots open because we always have people that are calling in for same day appointments.
I think one of the really interesting things that you mentioned just here is that you positively mark the patients that you couldn't get in touch with. Instead of just leaving that as pending or something like that, you marked it as unconfirmed. And then I think that that's a really good way to communicate to the rest of the staff, like what should be the next step. I think that's really important and really creative way of using the tools at hand to communicate effectively. The next question, of course, is what's been the impact on your show rate, your workflows, and your ability to have teams fill in these slots that were going to waste previously?
You can clearly see here, it definitely yielded great results. You'll see that with that high probability, that pre-go live was 15.75%, that post-go live, that basically more than doubled. So you'll see where our appointments here have actually increased. For medical, it was greater than 20%, dental, it was greater than 20%. So that is really just powerful numbers, because you don't usually see that big of an increase with hardly anything. But this definitely, we were able to immediately start seeing the benefit, which was great because it also helped the staff, because the staff was a little concerned if we're double booking and we're taking away these slots, what's going to happen when that person does show up? But what we saw was those patients weren't showing up. We were able to get those spots filled and look at that increase in our visits.
What was the experience working with eClinicalWorks in terms of putting this in place?
Working with eClinicalWorks was actually probably what helped us the most adapt this model, because we had someone meeting with us weekly, clearly walking us through the process, showing us how to utilize the data, giving us the support we needed, answering those questions. And we didn't feel like we were just thrown into something. We felt like we had somebody doing this with us, which I think is really, really important, because we had our finance department involved, because this was something that, in order to be able to sell this model, we wanted to also show that it generates revenue when we increase that visit count. It was a very, step by step, week by week, to the point where we started getting so comfortable where it was like, we don't have to meet weekly. And now eClinicalWorks will still reach out to us and we still get support, and just kind of checks in with us on a regular basis to ask us, do we have any questions? Are there any concerns?
And just to clarify for people who are watching, when you started on the module and you had the EBO report, that was a weekly refresh of the data. Now that you have it in version 12, you're getting updates every night of the data, but you were having a weekly call with the eCW team. Just want to make sure, people watching understood that. So the data is refreshing every single night. You get new updates every day for your visits that are coming up. But Stephanie, I wanted to say thank you so much for taking the time to explain the process and how this has worked well for you. I'm hoping that a lot of other practices can do the same. Thanks to some of the insights that you've shared here today. Thank you so much for your time.
All right, thank you.
If you'd like to learn more about the no-show prediction AI from healow, you can reach out to your strategic account manager or your business development contact, or log a case on my.eclinicalworks.com. Also, don't forget to check out our other eClinicalWorks podcasts on YouTube, Apple Podcasts, Spotify, and wherever you get your podcasts. Make sure you like, subscribe, and share with your friends if you enjoyed today's content. For the eClinicalWorks podcast, I'm Adam Salati, and thank you for watching.